Welcome, everyone. I'm Emma Soy. I'm a registered nurse with over 35 years of experience. And I want to start today by telling you about something I witnessed early in my career that had stayed with me ever since. See, I was working on a neurology floor, and we had a patient, a retired teacher named Margaret, who had come in after a stroke. She worked so hard in rehab. Her family was there every day. When discharge day came, everyone was celebrating. She was going home. 4 days later, she was back in the hospital. What happened? A fall and a medication mix up, dehydration. Her daughter, who had taken time off work to care for her, was exhausted and devastated. She looked at me and said, "No one told us it would be this hard." That moment changed how I think about the transition from hospital to home. And today, I want to share what I have learned, not to frighten you, but to prepare you. Because when you know what to expect, you can plan for it. Let's talk about what I call the discharge gap. This is the space between what the hospital provides and what your loved one actually needs when they walk through the front door. See, the hospital job is to stabilize, to treat the acute issue. And hospitals are very good at this, but their job ends at discharge. The instructions they send you home with often is a stack of papers printed in small font, and assume you have some kind of level of medical knowledge that most families simply don't have. Here's what the research tells us. Nearly 1 in 5 Medicare patients is readmitted within 30 days of discharge. For patients with neurological conditions like stroke, Parkinson's, or dementia, that number is even higher. And the majority of these readmissions happened in the first week, often in the first 72 hours. Why? Not because families don't care, they care deeply, but because no one has shown them what to watch for. I want to walk you through 5 things that shift dramatically the moment your mom or dad leaves the hospital. Number one, medication management. In the hospital, nurses bring in the medications at the exact time, the exact amount, the exact dose. Whereas at home, you are managing 5, 10, sometimes 15 different medications, some with food, some without, some in the morning, some in the evening, different times of the day, some that can be taken together. This is where most errors happen, not because of carelessness, but because truly it's very complicated. It is complicated. It's very confusing and complicated. That's number one, the issue with medication. Number two is hydration and nutrition. See, in the hospital is monitoring fluid intake very closely. Yet at home, it's easy to lose track. Your mom and dad may not feel like they are thirsty. They may feel, they may have some difficulty swallowing. They may simply don't feel like eating anything. And dehydration is one of the leading cause of confusion in older adults. And once steps in, confusion can lead to falls, okay, which bring us to the third issue. The third issue is mobility and fall risk. See, the hospital has side rails in their beds. The floors are flat compared to at home. You have thresholds, you have rugs, you have pets, you have stairs. And your mom and dad may be weaker than they realize. And they may try to do things, and try to do things the way they used to do it before they were hospitalized, they were hospitalized, without understanding that their body has changed and they're weaker, you know, they're not able to accept it yet, right? So mobility and high risk for fall is the second one, is the third one. The fourth one is sleep disruption. Hospital stays wreak havoc on sleep patterns. At night when the person is in the hospital, you have lights on, people are walking around, going back and forth in their patients' rooms, and you have it's a 24-hour kind of thing. People are always walking around, talking and working, and so that person really lose the track of sleeping day, night, their day and night kind of get confused. So when your loved one gets home, they may feel sleepy and they may be sleeping all day and be awake at night. And this could be a disruption for everyone's routine, which can also lead to confusion, agitation, and that could cause some caregiver exhaustion because the caregiver is trying to be up during the day to take care of the person. And also at night, they're not getting any sleep because this person's sleep patterns have changed. The fifth one is emotional adjustment. Coming home should feel like a relief, shouldn't it? But often it feels like surrounded with fear. Your mom and dad may be anxious. They may be anxious about another episode of whatever the reason is that they went to the hospital for. They may feel like a burden because now they need more help. They may be grieving the independence they lost because now they have to depend for someone to help them with the simplest thing, like go into the bathroom because they might be afraid they're going to fall. Help me with my meals. Things that they do that they enjoy doing for themselves. Now they have to be depending on someone else. So they might be grieving the independence, the loss of independence. This emotional way is real and needs to be paid attention to. And so that's the fifth thing that many people may not even think about. There are things, and so what I'm trying to say is this: there are things that you can do before your loved one, your mom, your dad, leaves the hospital that will dramatically improve the transition. What are those things? First of all, the first thing that now take a piece of paper and write these down. These are very important things that could help dramatically improve the transition. Number one, ask for medication reconciliation. What is the medication reconciliation? A medication reconciliation is having someone sit down with you, going over the list of medication that your mom and dad is going home with, or your loved one is going home with. Ideally, it would be best if the pharmacist had the time to do it with you, but you won't know if you don't ask. So you need to have someone, the nurse or the pharmacist, to review every single medication that your loved one is taking and is going to be going home with. Make sure you ask questions. How do they interact? Side effects, things that you should be watching for. Okay. So that is very important. Don't leave the hospital without this one medication reconciliation. That will help with the issue with medication that people have at home. Okay. Second, ask to speak with the physical therapist before discharge. Before you go home, whichever the physical therapist that's been working with your mom and dad, they know how they move around. So ask specifically, ask this, write it down. What can my mom or dad do safely? Ask them. What can my loved one do safely? The other thing that you can, as a therapist, what should they avoid doing? Okay. The third thing that you can ask them, what does the home that they're going to, what do they need? What does that home need to look like for them to be able to move safely? Are you going to remember that? Number one, ask them, what do they need? What should they avoid? What's going to make them be safe at home? How do they move? Ask them, and they should be able to help you with that. Number three, get the follow-up appointments scheduled before you leave the hospital. Because they usually tell you, well, Call this number next week to make an appointment. Mm-mm-mm. Try to see the discharge planner can help you actually schedule. Put it on the calendar between the doctor's office and your calendar so you can have all that set up, especially if you're going to have issue with transportation. Figure the transportation issue before you even leave the hospital. All of these things sound easy, but when you have to deal with them at home all by yourself, it becomes very difficult and cause a lot of issues. Number four, ask about warning signs. The question to ask, what specific symptoms should prompt a call to the doctor? What specific symptoms should prompt a call to the doctor? Write it down. What should send us to the emergency room? What should send us to the emergency room? Write these things down, write the questions down, write the answers down, and put them on your refrigerator. Put them there ready. All of these things are things that help you to be ready and be set and plan ahead so you can be successful, with the transition being from the hospital to home. Fifth, be honest about your capacity. Be honest about what you are able to do. Be honest about what you are able to handle. If you work full time, you have other responsibilities, children, home, other responsibilities that you have to juggle between home and work and taking care of your loved one. Discuss it with the discharge team. If you don't live far, if you have to travel back and forth, discuss it with the discharge team so that they can help you plan appropriately. If they don't know your real situation, they are not able to help you set up for success. So these are the kind of things that you can plan ahead, and they sound very simple, but they make all the difference between being successful for the first 30 days after being discharged from the hospital. In closing, I want to leave you with this. The discharge gap exists because our healthcare system is fragmented. It's not your fault that you feel unprepared, but you can close that gap by asking the appropriate questions. You can close that gap by planning ahead. And you can close that gap by being realistic about what you can and cannot do all by yourself. Caring for someone you love after a hospitalization is one of the hardest things you will ever do. You deserve support, you deserve information, and you deserve to feel confident, not terrified, when you have to bring someone home. Now, if you have any questions, you can always send us any questions that you might looking for answers for. What's on your mind? Whatever it's in your mind, I just cover some of the information that might come into your mind. Send us some information. Send us those questions, and we will be able to reach out and we help you. What situation are you facing? There are no wrong questions. There are no stupid questions. Just ask ahead, send us questions, and we'll be more than happy to give you some guidance. Okay? um, a few questions that we've heard from other family members that I can share with you. Maybe it will be able to help you. Number one, how do I know if something is a real emergency or just part of recovery? How do I know if something is a real emergency or just part of the recovery? This is one of the hardest parts. In general, sudden changes are what to watch for. Hmm? Sudden changes are what to watch for. Sudden confusion, sudden weakness on one side, sudden difficulty speaking or swallowing. See, gradual improvement is expected, but sudden decline is a red flag. When in doubt, call the doctor's office first. They can often tell you whether it is something that you need to visit the emergency room for. Another question. that I've heard. My parents refuses help. They say they are fine. What do I do? This is so common. And it's usually come from fear, fear of losing independence, fear of being a burden, fear of what accepting help means about their condition. The answer is start small. Don't frame it as you need help. Frame it as I need the peace of mind to know that everything is well with you. Make it all about you. I need the peace of mind knowing that everything is well with you. Sometimes starting with just one thing, such as having somebody to come in for medication reminders, for example, is very simple, but it opens the door to being able to receive more help later on. What if I can't take time off work? You're not alone in this. Most family caregivers also work. The key is building a team, even if it's informal, a neighbor who can check in, a sibling who can make a phone call or who can handle phone calls or set up appointments or who can take someone who can take your parents to doctor's appointment. It's to build a team. Professional support for hours that you can't be there. You cannot do this alone. And trying to do it by yourself will eventually break something. Let me say that again. You cannot do this alone. And trying to do this alone will eventually break something. Break what? Break your health, break your job, break your relationship with your loved ones. How long does recovery take? That's the other question that I hear often. This depends on so much on the individual and the condition. For a stroke patient, the most rapid recovery typically happens in the first 3 months, but improvement can continue for a year or more. For progressive conditions like Parkinson's, the goal is often to stabilize and maintain function. The honest answer is that recovery is not linear. There will be good days and there will be hard days. So it's just have to do with who the person is and what is going on with them. What else is they facing? Other health issues that they may be facing. So, in closing, I want to thank you for being here today. If you are facing a discharge soon, or if you are already home and having some issues and struggling, I'll be more than happy to talk you through some specific situation. I offer complimentary consultations because I believe everyone deserves guidance during these transitions. Call us at 704-209-5040. Send us an email or your questions at info@gentleshepherdcare.com or visit our site www.gentleshepherdcare.com. We are here every Wednesday at noon. If you find this helpful, share it with someone who might need it. Would you do that? Take good care.